Good day, friends of Buzzy. It is May 26th, 2021, and we are looking pretty good as far as COVID goes. We are almost at the level of cases that we were last spring. So this is even before the minor bumps in the summer, and of course, well better than the winter. So let's talk today about what we should do now, what to expect, and where things are going to be in the fall. All right, so right now, because we're in such good shape with new cases, we are at about 5 cases per 100,000 in Georgia, which is astounding. The number of cases where we really start to worry, international travel starts being an issue, that's around 50 to 100 cases per 100,000. In Sweden right now, they're at about 500 cases per 100,000. Which means that there's still a good chance of transmission and pockets of infection blowing up. But in the United States, we have about 50% of eligible adults vaccinated. And while this is not at the numbers that we were hoping for herd immunity, it's certainly not a place we need to worry about. Now, what's contributing to that? In addition to vaccination, we have the weather. 48 degrees was where we discovered last winter, and fall was the tipping point where the virus survives. It does not get humidified and drop with the aerosol when it goes out. And the winter months being closely kept in, that kind of thing is not a problem. So for right now, until it hits 48 degrees Fahrenheit, we should be in pretty good shape. What does this mean for everyone? Well, there are a lot of different opinions. I saw something the New York Times did about 100 different epidemiologists trying to figure out what they would do for their kids, how to handle the unvaccinated. A couple good pieces of news. The vaccines that Moderna and Pfizer are doing for children are 100% effective for those teens from 12 to 17. 100% effective. No one's getting sick. Now, part of this is because the sinus cavities of children are smaller, and so they're not replicating as much to begin with, but they're not getting sick. So that's pretty great. What about schools? Honestly, we're at a place now where we can protect the teachers with vaccines. Only people who have organ donation issues or the organ transplants are not responding to vaccines. So we should be able to protect our teachers, and the kids themselves are at very low risk. I am personally not a big fan about wearing masks for children. I wouldn't make my kids wear them if they were that young. They are older now, so maybe I'd feel differently if they were younger. But the reality is, when you are at a case level of less than, I'm being arbitrary here, 25 per 100,000, the kids are not going to come in contact with people who are sick very often. Younger kids, 12 and younger, they don't have developed sinuses anyway, and so many people are vaccinated that I would not actually have them wear masks. So that's a little controversy for you, but I think that regardless of how safe we are, the reality is we're pretty safe for now. So what's going to happen in the fall? All right, first let's tackle variants. Thus far, almost all of the studies that have looked at vaccines have found that they're very effective against the variants. Now, sure, things can mutate more, but the reality is that the way that the Moderna and Pfizer mRNA vaccines work, they're probably going to be able to latch on to just about any part of that spike protein. So even if there's a minor variation in the spike protein, it can't change that much and still infect you, and those vaccines should still be good. What about the issues of more transmissible vaccines or people who've gotten J&J or AstraZeneca? Yeah, okay, so variants can definitely be a problem, but there's also the T cell immunity, which is kind of the recipe book for making the antibodies. And that is really seeming to be very robust in causing immunity. So I think that we are going to be in really good shape with vaccinated people, even against the variants. People who have gotten sick and then have their immunity wane and get exposed to variants, now that's going to be a problem. Which leads me to the next thing. What should we be doing now? Okay, well, we we have a very different level of transmissibility of this virus, depending on whether it's winter or it's spring, depending on whether you're indoors versus out. So right now, we do need to be changing our ventilation for fall and winter, and probably years going forward. We know this is an aerosolized virus. Whether it becomes more deadly or less, 80% of times in history, viruses have become less deadly. So that's likely to happen. Nonetheless, if it doesn't become less deadly, we now know how important ventilation is. And this is not our first pandemic. This is probably not the only one this decade. So as we wait to see what happens with others, we need to be aggressive about using UV light in the air conditioning systems. We need to improve ventilation. We need to replace old units that are not circulating much and replace them with ones that are circulating air at least 10 times in closed areas. The other big thing we need to be doing this summer is addressing the fact that we only have half of our population vaccinated. This isn't going to work. We're going to need boosters at some point, and we're going to need to have the understanding of how to more efficiently get vaccines out. Right now, it's all hands on deck, but what happens when the government's no longer subsidizing vaccines? What happens when you have to pay for them? I wrote an op-ed in MedCity News that was published this morning talking about the fact that this is a fantastic opportunity to do really good research on why needle fear happens and how you address it most efficiently. So right now, there are 3 different things that almost everybody who's interviewed about how to deal with needle fear talks about. They talk about topical anesthetics, they talk about extinction therapy, and they talk about distraction, looking away, thinking about other things, sort of psychological interventions. What they don't talk about is proven physiologic ways to deal with fainting, because while fainting and fear are kind of Venn diagrams that overlap, there are really proven ways to address fainting. Topical anesthetics that almost everybody talks about are not proven to reduce anxiety at all. In fact, one study by Jen Luman found that when looking at a topical anesthetic for IV access for pain versus doing an extra needle stick for pain, that the worst time for the kids who were in the study was taking off the plastic wrap that holds the numbing cream in place. So the only studies that we have that look at anxiety and topical anesthetics, first of all, they're in IVs. Second of all, made it worse. So when we're talking about injection fear and pain, we cannot conflate that with pain or fear from IV access. You just can't. They're very different procedures, very different types of interactions. Now, what we can do, though, is look at fainting and needle pokes. So it turns out that actually asking someone about whether they have a fear is helpful, because then it lets the staff do something about it. We have another video that talks about how to train your staff to be needle fear friendly. That's not this one, but suffice it to say that it's okay to say, how do you feel about your shot today? Because that will open up the discussion. And if they say anything like, well, nobody likes them, then you can start talking about, well, what is it you don't like about them? Does it make you feel funny? Or is it just that you've got this panic inside? And then it gives permission to talk about it. We did a survey and found that 52% of the people who are not yet vaccinated have some degree of fear of needles. Now, it's really hard to research this, because if you ask somebody, are you afraid of needles? It's kind of a socially undesirable trait. It's sort of like if you ask someone, do you dislike your mother-in-law? Because if you say yes, you're a jerk, and she might find out. So it's much better to say, how much do you like your mother-in-law? And then you get a spectrum of a 0 to 5, and then you can be a little bit more honest. It's even more analogous, I think, to say, maybe, do you leave the bathroom without washing your hands? Or do you pick your nose and wipe it on a piece of furniture? Because those are things that everybody does, at least I do. Everybody does at some point, but if you give people a spectrum of time, then people can be more honest about, okay, maybe once a month do I wipe a booger on something, or no, I'm definitely a tissue gal all the time. So you get my point. we can't do studies that are asking, are you afraid of needles? When we did our survey, we asked people if they were afraid of needles, and only 18% said yes. When we said, how afraid of needles are you? 52% said they were either 3, 4, or 5 out of 5 afraid. All right, that's really different from 17, 18%. It really matters how we ask. And that is the point of my broadcast to you today. We have to ask. We have to figure out how to find this out, how to identify people that have fear or fainting or panic and help them. Is it pain that they need to be relieved? Which things work for pain? Is it sitting down? What kinds of distraction work well? Distraction actually was mentioned by about half of the people who told us how they deal with their needle fear. Distraction was very effective. It's something that is easy to teach. It's free. You can tell someone, all right, if you have to get something that you don't have anyone there to support you, think about whoever you're protecting. That actually helps. It can be look across the wall at a sentence and count how many letters have holes in them. Something that's difficult, but not impossible. And by the time you start figuring out the task, because it's unusual, then you're finished. One really cool study that was done in pediatric intensive care units looked at teaching children how to cope with pain. The cool thing was that comparing teaching kids how to cope with pain and offering kids someone giving them distraction and meditation, 6 months later, all the kids who'd been taught how to cope with pain still used those techniques. The kids who had been exposed to meditation weren't able to marshal their strength to get together and use those tricks. So now is the time with adults to figure out, okay, is it better to solve a visual puzzle? Is it better to think of a loved one? Is it better to do my looking at letters and counting tricks? There has to be a difference. It is not hard to study this stuff. What works better? Does Buzzy work better? Or does extinction therapy done in a 5-minute, right before you go get vaccinated, picture wheel work? You know, there also is some work in France looking at exposure therapy with sort of subliminal messaging in videos, you know, showing people videos and then gradually showing them longer and longer pictures of a needle. Does that work? I have no idea. Seems a little woo-woo. Who knows? Now's the time to find out, because now is when all the people who are afraid of needles but are not irrational and they want a vaccine want help. Those guys will show up for studies, and it's time to do them. So to recap, before we get into the next wave, because there will be a next wave, I don't know how big it's going to be. I cannot imagine it will be as bad as last winter. I really don't think so. I think that what we need to do is figure out who's afraid of needles, get ready for the booster shots, and marshal our forces to clean up our air vents, clean up the problems we have that can transmit it, and open our eyes to the fact that we need to meet patients where they are. And now's a great time to figure out what's really going to help. Stay safe, get vaccinated, and thanks so much for tuning in. Thanks so much for tuning in. It's going to be fine.